Well, there are growing concerns over food insecurity in South Africa, with an estimated 7 million people in the country going to bed hungry. The majority of them are women and children. Human rights organization Black Sash recently held a public discussion on women and food security, where harrowing tales were shared on the daily challenges of putting food on the table. Last year, the organization also commissioned a research report entitled Children, Social Assistance and Food Security, which found that the child support grant is insufficient to meet the nutritional needs of children. So let's unpack the story even further. We're joined now by Amanda Rinquest. She is a National Education and Training Manager at Black Sash and joins us via our video link this morning. Amanda, it's great to have you with us on the program to shed some light on what is such a heartbreaking issue. And I think this opening statement from Black Sash just says it all. Almost 6.5 million people in South Africa go to bed hungry every night. It's hard to wrap your mind around that.
Yes, good morning, Michelle, and morning to your viewers. It's hard to imagine in a country that has food on a macro level, that in the home level, people are going to bed hungry. And it's unacceptable, and it's contrary to everything that, every policy that we've developed in South Africa around children.
So, I mean, we're not a food insecure country. That's where sort of this juxtaposition comes in. And yet so many of our people are food insecure.
Yes, and this is an accessibility issue, but also an affordability issue. That people simply cannot afford food anymore. The food basket price keeps increasing. Pietermaritzburg Food Security Group keeps monitoring the monthly cost of basic food items, and we all understand how that the cost of living has increased, but the cost of basic food essentials, rice, maize, soy mince, beans, those basic food items, milk, keep going up. And people are unable to feed themselves and their children.
Yeah, absolutely. I want to talk to you more about this research report that was commissioned by the Black Sash at the end of last year. The title is Children, Social Assistance and Food Security, and it talks about the child support grant and how it is wholly insufficient to try and ensure that children are not only just fed for the sake of being fed, but that they are able to access nutritious food that helps them through the different stages of early childhood development, from babyhood, early childhood development, and so on. I mean, for now, the child support grant in its current state, it doesn't do that, right? It doesn't give any provision for ensuring that the quality of the food is there.
Yes, so the research report was commissioned by the Black Sash and included two phenomenal researchers, Dr. Chantal Witten, who is at the forefront of child nutrition and issues of stunting, issues of the malnutrition in children, and then also Dr. Wanga Zembe. And the report found that there was one is that the child support grant is insufficient, but also the consequences of that insufficiency is multi-pronged. One is that children are suffer from malnutrition. One, there's stunting. There's either obesity because children aren't getting the right kind of nutrition, but more than that, there's also psychological consequences for mothers when they can't feed their children, what it makes them feel like emotionally, what kind of mental health challenges it presents in mothers who feel like they aren't able to provide for their children. And so those were the findings, some of the findings of the report, which is available on our website.
Yeah.
And those were harrowing.
Yeah, I mean, there's one story here that I just have an outline of the report in front of me. You talk about those harrowing stories. One of them where women on farms share stories of how several of their members boil water in foodless pots to give their children the sense that food is coming. And of course, it isn't.
Yeah. The women on farms share that it's the idea that maybe in the morning when they wake up, there'll be something in that pot. Yeah. And then obviously children go to school and get a meal there. But it's the reality of people, and it's the reality of women who are primary caregivers in South Africa to children, and who disproportionately suffer from poverty and inequality and unemployment in South Africa. And all of these issues are interlinked, and all of these issues require multiple solutions. And the report and the Black Sash presents some solutions, if I can quickly go into it.
Yes, I want to get into it with you in a moment, Amanda, because I just want to stay with the issue of, the multiple consequences of food security for young mothers, for children as they grow up from babyhood and go into... it affects every single stage of their lives. If we think about the education outcomes in particular communities as well, it's all, as you say, interlinked. Yeah,
and that's absolutely... So what we know is that obviously proper nutrition is needed for development, mental development, your physical development, and there are all sorts of other research reports that speak to the issue of the consequences of malnutrition. We know organizations like Grow Great, which is a partner of ours and speaks to the issue of stunting, talks about the physical consequences. But we did interview mostly caregivers, and it's just the idea that, women feel hopeless. They feel a sense of a failing. There are many other examples of what's happening, but the more we don't address the issue of food insecurity in South Africa, the more we're also going to have a mental health crisis on our hands, the more we're going to have a child stunting crisis on our hand. We're going to have an education crisis because, we do know that children get a meal at school through the national feeding scheme. But if those meals aren't nutritious enough, we know that we're going to have an education crisis also, which we already have. Yeah. And so all these things are interlinked, and the food is for man to live, man must eat. For man to work, man must eat, as Engels said. Yeah. And so these things are the fundamentals.
Yeah, I would challenge anyone to try and get by on a full day of work or school on a single meal that is being provided by the school feeding scheme. So, Amanda, let's talk about the recommendations insofar as the child support grant is concerned. Essentially what the Black Sash is saying is that the child support grant, it shouldn't be expected that it's used solely for the provision of food. Essentially, it needs to be expanded because there are various needs that children are faced with. Insofar as getting to school, you talk about the child support grant including school uniforms, early childhood development care, scholar transport, free basic services, etc., etc. So basically an expansion of what the child support grant is currently doing.
Yes, so I think the first thing to note is that Stats SA releases what is called the food poverty line, which is the basic amount of money you need to survive, to eat properly in a month, and that's 624 Rand. The child support grant is 480 Rand. Then Stats SA releases the upper bound poverty line, which is the minimum amount of money you need to feed yourself, to supply yourself with some energy, like electricity, paraffin, maybe some transport, and that's the upper bound poverty line is 1,324 Rand, or 20 Rand if I can remember correctly. As you can see, the child support grant is wholly inadequate. So the child support grant must increase, and it must increase to at least some sort of not a pie in the sky amount like 480 Rand. It must be set to something like the lower bound food poverty line. Right. But at the same time, we want a comprehensive idea of social security and a comprehensive idea of food security, which is that you mustn't just be giving people 480 Rand. It should be like a cash plus system. So maybe food vouchers also, food parcels when you collect your grant, or maybe children in quintile 1, 2, and 3 schools, so schools that are free and get the meal every day, which are your poorest of the poor students. Maybe those students must also be supplemented with some other kind of like food vouchers or other nutritional needs that they can take home to themselves. But it's the idea that we're not just giving people a grant, but we're also creating a food security system, a food bank in South Africa that makes sure that no one goes to bed hungry and addresses different needs, like when children need are breastfeeding or need some sort of powder, and what they need at the age of 3 to 4, what they need as a high school student. We don't want our young people in South Africa to starve.
Yeah, absolutely. And what you're saying about, social security, the child support grant is not just, as important as food security is, it's part of the picture only. There's a social security picture that is not being attended to.
Yes, and so the National Development Plan in 2013 spoke about this idea of comprehensive social security, and it's something that the Black Sash is trying to do more research on, which is the idea that there's a basket of needs that people have, and that we try to fulfill those. So that means when you're born, you have certain needs. As you go older, you have access to free education if you need. You get meals at school. You have access to a functioning healthcare system. You have NSFAS that helps you at the university level. So South Africa has all the elements of a comprehensive social security. It's that these things are not always connected. Yeah. It's not automatic that if you went to a quintile 1, 2, and 3 school, you would get NSFAS because you obviously couldn't afford school fees. It's the idea that you would be able to afford university fees. So the idea that NSFAS must be related to you, and those things must be related to your child support grant, which gets you access to certain healthcare needs, which gets you access to certain food security needs. The idea that we have a comprehensive social basket for the poor, and those things are all related to each other and interconnected in a functioning system. Yeah. So that's what the Black Sash is also calling for, which is comprehensive social security, which looks after people in a coordinated way, so that we don't spend money on administering too many different systems.
And also, just as opposed to just paying out 480 rand, and that's that.
Yeah, it's the idea. It costs so much money to administer grants, costs so much money to administer NSFAS, it costs so much money to administer school. We've got to find a way to use the money directly on people and not on administrative systems.
Amanda Rinquest, thank you so much for joining us this morning. Such an incredibly important topic, and this idea of a comprehensive social compact, social security package for particular vulnerable communities. But at the moment, 6.5 million people in South Africa going to bed hungry every night. Amanda, thanks very much indeed for weighing in on this.